A baby born in London from a transplanted womb. Does this change what's possible for women everywhere?
Today's date is May 14th, 2025. For the first time in the UK, a baby has been born to a woman with a transplanted womb. That's a medical first for Britain, isn't it?
Yes, exactly. And it's the result of more than 25 years of research in this area. Grace Davidson, she's 36, from North London. She gave birth to her daughter, Amy Isabel, back in February at Queen Charlotte's and Chelsea Hospital.
Grace was born with Mayer-Rokitansky-Kuster-Hauser syndrome, right? She didn't have a functioning uterus. How common is that?
It's rare. About 1 in 5,000 women in the UK are affected. Many only find out when they're teenagers. For Grace, the solution was extraordinary. Her own sister, Amy Purdy, donated her uterus. The surgery happened at the Oxford Transplant Centre under the Womb Transplant UK Living Donor Programme.
So just to clarify, her ovaries worked, but she needed IVF to create embryos?
That's right. Grace's eggs were fertilized via IVF. After the transplant, the embryos were implanted. The baby was delivered by cesarean section and named Amy Isabel, after both her aunt and one of the surgeons, Miss Isabel Kirega.
Who actually performed the surgery? Or rather, who led the team?
It was led by Professor Richard Smith, a gynecological surgeon, and Miss Isabel Quiroga, a transplant and endocrine surgeon. The project's funded by Womb Transplant UK and approved by the Human Tissue Authority. It's part of a program aiming for 5 transplants.
That's a real collaboration. But what are the main risks? Because most transplants are about saving lives, not creating them.
That's something Dr. Quiroga highlighted. This transplant isn't just about enhancing life, it's about creating it. But yes, there are risks. The donor, who's usually finished having children, goes through a major operation, a hysterectomy, which carries risks like infection or significant bleeding.
And what about the recipient's side?
A transplanted womb isn't meant to be permanent. The recipient has to take immunosuppressive drugs to prevent rejection, which raises the risk of infection. Usually, after having children, the womb is removed so the drugs can be stopped. There's also the risk of the transplant not working, and the long-term impacts on both mother and child are still being studied.
So, this requires close monitoring. Where does the UK stand globally? Sweden was the pioneer here, right?
Yes, Sweden led the way. The first womb transplant was in Gothenburg in 2013, with the first successful birth in 2014. Globally, over 100 womb transplants have been reported, and more than 50 healthy babies born. In the UK, Dr. Quiroga says transplant survival so far is at 100%.
Is this something that's open to anyone who needs it?
No, it's not widely available. In the UK, access is only through research programs, with just a few places. Candidates are women of reproductive age who don't have a uterus but do have functioning ovaries. Donors are usually close relatives, and both donor and recipient go through thorough assessments.
How about costs and regulation? Is the NHS covering this?
Not at this time. Because it's experimental, the costs are high and only a few surgical teams have the expertise. Most countries don't offer it, or it isn't covered by public insurance. There are also ethical and regulatory challenges.
So, who decides who gets it? How are priorities set?
It comes down to strict medical criteria: clinical need, readiness, compatibility, and the ability to handle surgery and IVF. Prioritizing is difficult, especially with so few opportunities.
Big question here. If this becomes routine, would public health systems fund it? And what about ethical oversight?
Those debates are ongoing. As these procedures move from experimental to more routine, policymakers will need to weigh costs against the benefits for women who can't otherwise have children. Ethical oversight, like from the Human Tissue Authority, will stay crucial for consent and fair process.
So for one family, this is a breakthrough, but for many others, access and ethics will decide how much it really changes.
Exactly. For Grace and her family, it's about their child. For the wider world, it's a sign of what could be possible in reproductive medicine.
A baby born from a donated womb, a UK first, and potentially a turning point for fertility science. Thanks for joining us. We'll be back with more stories tomorrow.